When we think of trauma, we think of two presentations. One that we call simple PTSD, nightmares, hypervigilance, avoidance, and negative feelings about oneself and one's future. Then we think about more complex presentations in which somebody's experienced recurring trauma, usually starting in childhood. In addition to those typical PTSD symptoms, we can see difficulty with a sense of self, emotion regulation, interpersonal relationships, and essentially an inability to deal with life as life comes. There are many evidence-based treatments available for trauma. Here at Union Square Practice, we offer prolonged exposure, eye movement desensitization and reprocessing, as well as cognitive processing therapy. You and your clinician might focus on building up resources, whether internal or external. This could include grounding techniques such as mindfulness, meditation, and other stabilization techniques. When I first start working with somebody who's experienced a traumatic event or a series of traumas, they come in very nervous, anxious, often mistrustful, and it makes so much sense. The world as they experienced it prior to that trauma is turned upside down. So we spend a lot of time building trust, focusing on goals, while I provide psychoeducation on what to expect during the course of our treatment. The key to any effective trauma treatment is to make sure you're working with a provider whom you trust, someone who hears what you have to say and respects your experience.